Namaste and good afternoon. Greetings from all of us at Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I'm very happy to see you all again. Apollo Hospitals has always been at the forefront in creating health awareness. And with our Facebook Live sessions, we've been bringing to you authentic information on diseases, path-breaking treatments, latest technologies, and medical innovations. This month, our emergency series aims to create the much needed knowledge on handling common medical emergencies. And one such emergency is head injury. A head injury is defined as any trauma to the scalp, skull, or brain. It can be minor or it can be a serious head injury, injuring the brain as well. It can be a closed injury or it can be a penetrating or an open wound. Head injuries can be a concussion in which the brain is shaken up, or they can be scalp wounds, or they can be skull fractures, and they may cause bleeding as well, either in the brain tissue or in the layers that surround the brain, which is why we have names like subarachnoid hemorrhage, subdural hematoma, extradural hematoma, which you may be aware of. Head injury is a very common reason for an emergency treatment to be required. And there are a lot of people, including children, who suffer from head injuries. So, to guide us and tell us on what to do if faced with a head injury, I'm delighted to welcome Dr. Tarak Nath Das. Dr. Tarak Nath Das, with a fellowship in emergency from the Royal College of Physicians and a fellowship in critical care medicine, is a consultant in emergency medicine and head of the pre-hospital care emergency services, certified BLS and ACLS instructor of the American Heart Association, consultant emergency medicine at the Apollo Multispeciality Hospitals, Kolkata. He comes with over 18 years of experience in emergency medicine and specializes in the management of polytrauma, cardiac emergencies, resuscitation, acute strokes, pediatric emergencies, etc. He's a member of the Society for Emergency Medicine, member of the Trauma Care International as well. Welcome, Dr. Das, to this Facebook Live session on head injuries. And let us first begin with a defining of what exactly a head injury means.
The head injury means uh, blindly trauma to the head, and it affects the surroundings of the heads, including the scalp and the bony structure, and inside the tissues and the vessels which is injured during the trauma. So that way, the head injury occurred, and followed by some clinical symptoms appears to the patient, and that way we actually finding out there is a head injury, and according to the head injury, we are treating the patients actually.
So there are, I mean, head injury is a very broad term and can involve many different types of injuries. So could you describe to us what are the different types of head injuries?
Actually, broad way, the head injury is actually open type head injury and the closed type head injury. Open type means the injury to the scalp and the bony structure is affected, which is can be seen from the outside. We can see there is a obvious injury to the head, and another injury is there. Everything is intact outside the head, but there is a injury to the vessels and tissues of the brain, which affects inside the brain. And further classification, the head injury is actually described as a contusion, concussion, and the scalp fracture, and the intracranial hemorrhage, subdural hematoma, interventricular hemorrhage, like that. So, in a concussion, there is a mild head injury occur, which is just a sickening of the brain, and the concussion is sometimes may fatal, which is required hospitalization or seek the hospital advice for what to do the next. And contusion means that is there is a abrasion injury inside the brain tissue, which affects the brain and the brain tissues, and that leads to patient maybe feeling drowsiness, sometimes confusional states, and patient sometimes vomiting, headache is there. So that where the mild to moderate and to severe head injury may occur. So accordingly, we are actually treating the patient.
Um, So this concussion, could you explain a little more in detail? As in, what are the symptoms that happens in a concussion? Like, is it true that so people sometimes don't remember anything and then it comes back? So what exactly
Yeah,
happens?
actually, in a concussion means in our clinically we are telling that concussion means is a very mild types of head injury, but it's may fatal if there is a sign symptoms like patient is feeling some headache, sometimes the nausea, vomiting, and lethargic feeling, and sometimes the patient is feeling drowsiness. That time you should must take medical advice because concussion is a very mild injury of the brain, but sometimes it may fatal if you not seek medical help.
If it is not, otherwise, does it get okay on its own, or is it that it always needs medical help?
And it's always not required medical help because if the patient is suffering from concussional injury, there may be sometimes post-traumatic amnesia. Patient may forget something happened, which is happened to him. So this type of incidents, if occur any patient, I think they should at least take advice from the doctor what to do next because concussional injury is clinically mild, but it may be fatal if not taken properly guidance or advice from the doctor.
So, in the case of an internal injury, like a closed injury, how
Yeah.
does it? How do you identify that there's something wrong? At least if it's an external injury, they might be bleeding. So, how do you really identify that there's something that's gone wrong?
Exactly. As a doctor, actually, we are actually clinically examination is a part, one part, and another part is some imaging part. So clinically, the patient neurologically will be some deficit will be there. There will be a pupil reactionary deficit will be there. There will be some plantar deficit. So there is some neurological examination by which we can diagnose there is something is problem is there inside the brain, and otherwise we can do the best choice of investigation is CT scan of brain, and the CT scan of brain you can find out there is any scalp injury, that means the bony injury is there or not, inside the brain there is any injuries there or not, intracranial hemorrhage is there or not, any interventricular hemorrhage is there or not, how much bleeding is there, and the bleeding is that much of bleeding is there which can actually mass effect is there inside the brain is there. So that we can actually find out whether patient is suffering from severe or mild type of headache.
So, what are the common causes of head injury?
Exactly. So the common causes of head injury is actually road traffic accident. In our developing countries, most of the patients are driving in a reckless way, and they are not wearing sometimes seat belts. They are using mobile phones during driving, and that is the main cause of our actually road traffic accident followed by head injury. Sometimes the pedestrians are also coming to the highway, middle of the road, and sometimes not wearing helmets. Sometimes sports injuries may can happen to the head injuries. Sometimes violence can also affect the head injuries. Sometimes blast injuries may affect the head also, and that followed by the head injuries also. So that way there are some something is there for falling from the heights also can be lead to head injuries. So these are the common causes for head injuries.
And as you rightly said, doctor, I think the main safety issues of not wearing the helmet or the seat belt is a common cause. So,
Yes,
what
yes.
about is it also does it affect children and
Yeah,
babies due to
it is
falls?
found that the head injuries is very risk for 0 to 4 years of male children, and very at risk groups are mainly 15 to 29 years of young adults. And further, there is a risk for head injuries like above 65 age, which is actually vulnerable age. So these age groups are actually vulnerable for the head injuries.
We already discussed some of the symptoms of head injury. So you spoke about the headache and drowsiness and all. So are there any other symptoms that can present in a head injury?
So mainly head injuries problem is that clinically uh, the patient will mainly complain there is a lightheadedness, there is a alternative of the cells, there is some loss of consciousness history, there may be a history of bleeding from the nose or the ear, there may be a history of direct hit to the obvious injury to the head. So this type of injury will be told by the patient party, and sometimes as a doctor we are neurologically examine the patient. There will be a neurological deficit of the patient. Sometimes one side of the body may be not working properly, and there will be pupillary reaction which is not properly showing the same. And there will be another scale is the Glasgow Coma scale, which will actually we are measuring the mild to moderate type of head injuries, because the higher the score, it is actually 15 score, and if the score is 15, that means there is a mild type of head injury, and if the score is 12 to 14, there is a mild moderate type of, and below 10 actually severe type of head injuries are usually we are actually identified for the patient. And obviously we are doing the CT scan, which actually tells us the actual how much type of head injury is there, and whether which type of actually intervention is required for the patient, whether operation is required or conservatively patient can be treated or not.
Right. So once the patient comes to the hospital, so what are the investigations that are done in the emergency if there is a case of head injury?
So as a emergency physician, we are actually already geared up if the information is there. So first of all, we have to provide the patient airway breathing circulation first, and also protection of the spine first by the collar, because each and every trauma patient with head injury is suspected there may be a spine injury. So there must be a protection of the head along with the spine, for protection of the spine, because if there is a head injury, treatment is there but spine is not treated, then rest of his life patient will be in a quadriplegic state. So as the emergency physician, we should control the air breathing circulation as well as the spine also, and also the fluid resuscitation, pain management. If there is any cut injury or bleeding from the head, that should be compression bandage should be there, and you must also follow there is any scalp injuries there, directly patient not given to the that area, so that this area can be protected from the brain tissue cannot be come out from the brain. So severe type of injury can be treated in a conservative way and as well as in an advanced way by operative procedure also. So if required, patient may be protected by the mechanical ventilation if required. So head injury is a milder form and severe form. So most of the cases come to our emergency is moderate to high. Mild cases is not coming usually in the emergency department. So we are actually posted as a ABCDE, means airway, breathing, circulation, spine protection, and deformity corrected, and then definitive management.
Right, doctor. So, when somebody, like, as most emergencies occur first, the first people to see will be the people around or the family. So, most of the times, apart from what you should do when confronted with such an emergency, there's also the question of what you should not do. So, could you tell us what are the do's and don'ts if somebody has a head injury?
Exactly. So when there is a suspicion of any head injury, do not wash the head wound that is deep or bleeding a lot. That means there is a bleeding is coming out, and don't wash, because further wash may bleed further. And do not remove any object which is striking to the heads. That means if the striking object is removed from the head, then there will be more bleeding is coming from that wound area. And to do not remove the person unless absolutely necessary. So unnecessary movement of the patient may further damage to the brain tissue or spine injuries. And do not shake the person if it seems dazed, because in dazed patient or there is a fall from the height or the rotavic accident patient, there must be a spine injury. So unnecessary movement can also affect the further injury to the area. And do not also remove a helmet. If there is a helmet is there, do not try to move helmet by the passerby or the pedestrians.
And what should somebody do, like if somebody has a head injury?
Okay, so somebody should just follow if there may be a obvious injuries there, bleeding is coming from, and there may be a closed injuries there. So closed injuries may be identified by the patient is not talking much. There is a alternative of the sense the patient is talking which is not relevant to the daily talking. Then patient is getting headache and patient is getting vomited repeatedly, patient is drowsy, becomes drowsy. These are the common symptoms which is leading to the head injury, and patient must be taken to the hospital if this type of symptoms is arise with the head injury.
Right. So we already spoke a bit about how head injuries are treated at the emergency. What are the investigations that are done? So are there any further like treatments that are done? Like, is there any surgery that is done? So what kind of approaches are used?
Exactly. So there are so many approaches for the head injuries. Like if there is the epidural hematoma, then immediately that operation should be done by the barrel operation, because epidural hematoma, subdural hematoma, this type of injury and further operation, patient is absolutely okay after the operation. And if there is a big intracranial hemorrhage, that can be also evacuated by craniotomy, because neurosurgeons are there. They are actually remove the scalp and release the pressure of the brain, because if there is head injury, there is a lot of bleeding occur inside the brain, and brain is this inside the scalp. There is a increased pressure to the brain tissue, and that will further damage the brain. That's why there is a craniotomy is there, which release the pressure. And again, some medication is also there to reduce the pressure also, and that way actually we are treating the patient.
So, talking about these terms that we subdural, epidural, subarachnoid. So, could you explain to us a little more about what exactly these are?
Exactly. So epidural hematoma means there is a brain tissue, and just outside the brain tissue there is something layer is there which actually cover the brain, and that area is, if there is a bleeding, there is a epidural. That means just starting of the brain. Then comes the subdural. That means just below that level. This is just adjacent to the layer of the brain. This is subdural area, and inside the brain tissue hole, the brain is there. If anything hemorrhage is there, that is called intracranial hemorrhage. And if you see the brain tissue in CT scan, there is a hole is there, big hole is there in the middle of the brain, which is called ventricles. And if the blood is there, that means it is the intraventricular hemorrhage. So that way you are actually describing the hemorrhage inside the brain. And sometimes there is a severe head injury is there, which is actually affected whole the brain, and including the contusion of the brain. There is the subdural hematoma, epidural hematoma, intracranial hemorrhage. Everything is there in one city, and this is called severe head injuries.
So finally, doctor, I just like to ask you, like prevention, of course, is the best method of avoiding medical emergencies. So what are the methods in which, we can safeguard ourselves against head injuries?
Actually, what are the causes actually affecting the head injury that can be actually prevent, because prevention is better than cure. So while driving, we must wear the seat belts, and the speed must be 45 to 60 kilometer per hour, because in this speed we can actually decrease the about 4 to 5% decrease of the road traffic accident. And also always wear the head helmets while we are driving to the four two-wheeler. And also in a working place or inside home also, we should see there is no wet areas there, because sometimes aged people and the children are actually sleep due to wet floors. So that can be also in mind also. And sometimes we are forget to look after the children 0 to 4 years of age, because this age is very vulnerable for head injuries. So every time you should look after this vulnerable age group, including the above 60 years of age also. That should be every time somebody should actually accompany them for preventing the fall and followed by head injuries.
So thank you so much. us for this wonderful discussion. So I'm sure our viewers have obtained a very clear view about head injuries and how to prevent them. So the message here, dear viewers, is very clear. Head injuries can be avoided if you follow, especially like on the road when there is a speed control, and then when helmets and seat belts are worn. Many a head injury, many a catastrophe has been prevented. So please do follow that. And as far as children and elderly are concerned, they are vulnerable. So please make sure that they are supported and they are not unsupervised, and they are in a safe zone where they don't slip or fall from a height. So take care, and you know that you can subscribe to our YouTube channel to get all the latest information on trending topics, and also you can write in to us for any further clarifications to all our digital channels. And you know that 1006 is the lifeline from Apollo Hospitals, which you can call for expert emergency assistance at any time. Take care, be safe, thank you, and namaste.